What's the most exciting thing about this product, in your opinion and experience?
I think the most exciting part of Oral Essentials is that I pretty much decided that there are 4 types of patients that I see in my office. There are patients that are concerned about their gum health, and they don't want to have gingivitis, or they have gingivitis. And we created a product specially for them, which is the original mouthwash. Then I have patients that are much more concerned about the color of their teeth. They want whitening, but they don't want the sensitivity. And they want to be able to use something that they can use on a daily basis because they drink tea, coffee, red wine, blueberry, blackberry, and all these different things. And our whitening mouthwash has coconut oil, sage oil, and lemon peel oil, in addition to all of the ingredients that is in the original mouthwash that creates that whitening. And then the third group of people that I see are people that have sensitive teeth. Sensitive teeth due to wear of the enamel, sensitive teeth due to too much whitening products being used. Either their toothpaste or whitening mouthwashes, hydrogen peroxides, and all these different things have broken down the enamel to the point that they have sensitivity to hot, cold, or any type of temperature changes in their mouth. So our sensitivity mouthwash is also taking care of those group of people with much higher concentration of Dead Sea salt with this mineral content. And the fourth group, I think this is the group that is overlooked to some degree. And having worked with patients, young and old, seeing the rampant cavities in their mouth and sort of not knowing as to why, it turned me on to this aspect of this particular mouthwash, which is our dry mouth mouthwash. So dry mouth, I think, as I mentioned in my latest book that I wrote, The Hidden Epidemics, is the part of the trend that I see in the future that is going to cause a lot of tooth decay, a lot of extractions, a lot of destructions of teeth. So for the first 10, 15 years of my practice, I hardly saw people having that much cavities. In the past 10, 15 years, I'm seeing a rampant growth of cavities in my patients' mouths. And part of that is either they're on different medications, they're mouth breathers, there's something causing dry mouth. So when you go on the site for CDC, Center for Disease Control, and you type what causes dry mouth, there's a list of medications that come up. It starts with antidepressants, anti-anxiety medication, antipsychotics, blood pressure medications, heart medications, allergic medications. So people that have allergies that they cannot really breathe through their nose, they're constantly breathing through their mouth. As a result, it's causing dry mouth. Now, why is that important? Because saliva is the #1 defense mechanism that the body and the mouth has toward what is going on and what's coming into it. It's sort of an antibiotic in itself. And when you don't have saliva, the cavity-causing bacteria run rampant. As a result, you're going to have all these types of cavities, and the cavities get bigger, and then teeth start to fall off. And in one of the shows that I did on a patient in the doctors, it's a 31-year-old man that has never abused drug. He was diagnosed with a rare genetic disease on his legs. He was in a lot of pain. He was given a lot of pain medication. After 4 years, he had none of his teeth left in his mouth.
Wow.
All rotten to the gum line. So imagine being 31 years old, somebody not telling you why the teeth are getting ruined. You have no idea, yet you're in so much pain as a result of other problems that you have, and you have to take this medication. So the psychological effect and also the cost of handling these types of patients in the future is something that is the forefront of what I'm constantly trying to figure out as to how to handle. So our dry mouth mouthwash is using coconut oil and grapeseed oil as a lubricant, and it's using cayenne pepper oil as an irritant to increase the saliva flow. Pretty much all of the things that I have seen falls within these 4 categories. So as a company, we decided that we want to handle all of these 4 patients, 4 categories of situations that come up with natural ingredients, and we have been able to do that. And what makes it even more exciting is that now the testing shows that when we use our whitening mouthwash against a leading brand mouthwash, we're getting same results for 3-4 months of use. And you cannot really use whitening mouthwashes that have hydrogen peroxide for 4 months. Your teeth will be too sensitive.
Right.
So we have found an alternative with naturally derived ingredients to sort of mimic chemicals, hydrogen peroxide, or other things that were being used in mouthwashes to handle problems. And I think that's what makes it so exciting.
That is exciting.
It is.